welcome to the latest edition of UPCEO Project Podcast. This is Francis San Diego. In today's episode, we have invited one of our good friends, our guest, Mr. Rudy Reyes. Say hello, Rudy.
Hello, everybody.
So, privilege of inviting Rudy, and good thing that he gave us a time to be one of our guests here in our podcast. Before we begin, I wanted to tell you about some short story about how I met Rudy. So Rudy is an expert in, actually he is certified instructor in first aid and CPR. And also by profession, he is also a respiratory therapist. Am I right, Rudy?
That's correct.
Yes. So it just so happened that in our agency, we were looking for some certificates for our caregivers, etc. And we just came across with Rudy. So, and I saw how he is doing the training for the first aid and CPR, and which is by far one of the best that I've seen train. He's like really simple, direct to the point, and like really no fluffs or something like that. All right, so enough of that one, and I'll leave the floor to Rudy. Can you please tell us about yourself and how you become a certified first aid instructor and at the same time a respiratory therapist?
Of course. Thank you for having me, Francis. Appreciate this project here that you've been working on, and to enlightening and sharing my skills and knowledge about respiratory, but also, of course, CPR. Yeah, just started respiratory. I've been in RT for the last 25 years. Went to Crafton Hills College and didn't go in there with the intentions to be in the medical field at all. It was just one of those things that your parents say, you gotta go to school and see what you can make out of yourself. I was doing some exploration as to see what would be the field that I want to get myself into. And respiratory was something that caught my attention. But it wasn't until I took the anatomy and physiology class that I realized that the medical field could be something that I may want to be part of. So from there, I became fascinated. As you're growing up in life and becoming responsible in life, you start to understand a couple of things about yourself. And of course, not only that, but how the world works around you, because you start to open up your eyes and seeing the world differently. You're no longer being cared for by now you gotta thrive on your own, and it was an experience that my eyes when I took this class, and that was set the foundation to where I am today. So doing respiratory was the transition of this class, of course, and was fascinating because when it comes to airway, which is our field, our skills is to maintain airway management, but also to perform and recover those if they are in trouble with respiratory. And that was the beginning of my life that I started to realize maybe this is something I want to do. I like the stress, I like the excitement, and I use the term excitement in my own terms because when you find yourself in an emergency situation where you have to bring a person back to life, so to speak, or getting comfortable and getting stable, to me was fascinating. It was a challenge. It was a challenge that I was willing to accept and take upon myself to do. But not only do it in an average way, I felt like I needed to do more than that. But the medical field is very complex. We have a lot of different understandings when it comes to a subject. As you all know, the medical field is based on theory mainly. That was another eye-opener for me, where most of the things that we know about the human body is primarily theory. With advances in the medical field, with technology, we've been able to assure that some theories are very realistic. So it makes it more fascinating to think that there are things that are spoken of as a theory, but now they are reality. It's a fact, basically. So when I started respiratory, I remember one of my teachers said to me that, not to me, but the whole class, was that 3% of the things that we know about is fact, and 97% is theory. And that was interesting to know that.
Mm-hmm.
And if you go to the hospital or see the doctor, one of the main famous wording behind that is it's that doctors practice medicine. And that's where the word practice comes from, because that's the truth. They are practicing theories and also facts. So it all comes into one part. And of course, today what we have is knowledge, wisdom, and experiences. And all we do is try to promote and make things better. But another challenge that we also encounter is not everybody understands certain subjects. Not everybody is equipped to deal with stress when it comes to the human body, of course, in trying to save someone's life. So there are different levels of individuals that learn different things based on the ability to understand the subject. And that was another thing that I wanted to encompass, was to, when I went through school, my learning was basically study, memorize it, pass the test, and then graduate and go to work, right? That is essentially how it works. But I feel there's a lot more than that. And I come to realize that just because you are a doctor doesn't mean that you know everything or that you're supposed to know everything. Just because you're an attorney doesn't mean that they know the law, right? There's different kinds of attorney, just like the different kinds of doctors as well. And respiratory is more specific, and it's one of the main focus in respiratory is to not only attend to those patients that are chronically ill, but also understand their chronic illness as well. And having the knowledge makes a difference between, or can be the difference between, making things better or making things worse. So that was another thing that I wanted to focus on, is focus on making things better, making things better. And although in my scope of practice, CPR is embedded in our career, so an understanding of doing CPR as well. And this is where I became a CPR instructor, because I wanted to know more about it. And yes, I did CPR prior to becoming a CPR instructor. And yes, I was able to handle airway management when it came to patients that were. But when you teach CPR classes, when you teach the airway management part, it does make things different, because there are a lot of, and I want to use the term students, whether they're in the medical field or not, that they just want to get through the process and not thinking that things are gonna go bad one day, right? Like, you could be eating at a restaurant, for instance. Just because you're CPR certified doesn't mean that you know how to react to someone that's choking. There are ways to handle different cases that can be handled differently. That's where I come in, and I needed to understand also that not everybody's capable of performing the task of doing CPR, but also not everybody's able to understand the concept of when you start to do CPR. This is why I became a CPR instructor.
Oh yeah,
Sorry.
there we go.
Okay.
Oh,
Okay,
yeah.
go ahead.
We'll cut anyway.
Okay.
Yeah, I'm really fascinated of how your journey is, and at the same time, I know that as a respiratory therapist, which is one of the most important professions in the medical field, save lives. So
Yes.
later on we'll talk about more in the real situations that you've encountered, so that at least here in our podcast we can share to them or give them some ideas on how to, if they encounter such situations, especially like choking and everything. And Rudy will do us a favor in terms of give some ideas on or how to save lives. Then part of the goal of this test is to cater or share some insights or ideas to the sandwich generation, which is in the families. I believe, for me personally, there's a lot of families out there that they don't know how to deal with such issues. For example, number one, correct me if I'm wrong, Rudy, but the number one issues that we've been encountering is like the choking, right? And how to properly help the person who is choking. And for a fact, probably Rudy, maybe you can give us some insights or some ideas that what's your take in terms of how does respiratory therapy or CPR aid the families out there?
Of course, it all starts to learn, and necessity happens to be what dictates the things that we do in life. And when you're speaking about the sandwich generation that don't have the knowledge, and they find themselves in a situation where they're taking care of their loved one, or even someone that is doesn't have to be their loved one, it could be someone that is next to them or a friend. Oftentimes they tend to not think about those things, and I don't blame them. It's like they tell you when you go swimming, for instance, there's safety you want to keep in mind. You don't just go out there and throw yourself in the water.
Yeah,
and say I'm going to go swimming. What you're dealing with first, but oftentimes we don't think about those things. And one of the most common is that what people say is that, or they express is they say, I hope it doesn't happen to me. Or I hope it doesn't, I never experienced that. And just the normal human way of reacting to stress. We don't want to deal with it. Let's face it. It's not something that you think of happening because we don't want to think about it. And so it starts from there. It has to be driven by anything can happen, and it doesn't have to. You don't have to be in a hospital. You don't have to be in a facility where you're actually taking care of those patients where things come up. It can happen while you're having dinner at home. It can happen while you're driving. Doesn't matter. The person is there and it can happen. And so once people start to realize I need to learn how to take care of emergency situations, and I need to have it in mind that this could happen at any given moment, that's the beginning of a good preparedness to have a good outcome. And I always say as well that you're going to do the best you can. As a respiratory therapist, I have had experiences where you're going to do what you can. You're going to do the best you can. You're going to follow the steps, try and find out what needs to be done in a situation. And sometimes even though you're doing everything correct and at a time manner, things happen where a patient doesn't make it. But that's how life is. What's important is that you did the best you could with the knowledge that you have. And that's all you can do is that you did something. I always say also, I'd rather know that you did something than nothing at all, right?
Correct.
And we see it all the time. We see it all the time where things happen to people and bystanders don't do anything. Even if you just pick up the phone and dial 911, even though you're not able to engage for whatever reason may be, it could be a safety situation where you're not able to attend to that person because of your safety. And that's another thing that we have to keep in mind is that, yes, we can do something. Even calling 911 would be the start to doing something, even though you may not be able to engage. Because let's face it, there are times where we cannot engage depending on the situation that the person is in. Because obviously you don't want to be victim number 2, depending on what the situation is, of course. But once you feel that you're safe to act upon to take care of that person, then yeah, you could. And you should be able to rescue that. But worst comes to worst, allow 911. Because when you call 911, they will coach you. They will guide you through what needs to be done as well. So you giving feedback to the operator, they can return and guide you to see what needs to be done. Even though you may not have any knowledge in the emergency you are, it's always good to at least call 911.
Yes, that's great. That's great to hear. Yeah, personally, that it's important for us in the household to know how to at least do the basic stuff, which is the number one thing is gotta go 911 right away.
Yes.
Then the important thing is for me is like to have a basic knowledge, especially in the respiratory thing, that if somebody's choking, what do you got to do in order to somehow save the life of the person being a victim or something like that. So in your Rudy, in your experience, what do you think is the most common respiratory conditions in the household, especially, let's say, for example, I know you will mention about the kids putting something in their mouth and they choke. In your experience, or at least in your own knowledge, what are the most common respiratory conditions that you've encountered in the household or anywhere?
In the household, Choking is one of the most prevalent, besides the fact that if there's no other medical the person has, when you're dealing with someone that's healthy and doing well, choking is prevalent. It can happen to any of us. They're saying, "Oh, I choke on my own saliva." So you're tired, you swallow, or if you're drinking water, you're choking when you're drinking water. These things happen, and it's important to focus on what are the steps that are necessary to come out of that. So to be right, to have a good outcome. When it comes to choking, anybody, doesn't have to be a child, doesn't have to be an adult. It depends on the condition. It could be someone that drinks, gets drunk. There's so many reasons why, basically, that's what I'm saying. But understanding what you're dealing with is the first step, and of that would be to identify the problem. We have what's called universal sign, where we grab our throat. If we're conscious, this is if we are conscious enough.
Yeah.
This is if we are reacting to what's happening. You will see it that, oh, you're choking because it's what's happening. But you may not find a situation like that. It could be where your loved one is eating, and then you step away from that table and come back, and they are over the table unconscious. It could be that you may not get the chance to identify that's what's happening. So assessing the situation is very important. Putting things together. So if someone is eating on the table and they're unconscious on the table, then that's probably what it was. It was probably a choking situation. Of course, what you do next is very important. If they don't respond to you stimulating them and grabbing their attention, they're not responsive, your first thing is to not dial 911. That's just an automatic thing that you want to do. But let's say that you do know what you're doing, 911, and you have a phone. You is to understand what that we're dealing with now. Why is this person unconscious? And of course, if they're eating, you're going to see some residual food in their mouth. That will be one of the indicators. It would be that they are drooling through the mouth as well. That's another indicator. And of course, from there, you have to pull them out of the chair. If they're sitting on the table, in order for you to help them out from where they're at. And then, of course, you have two choices at this point. Either get behind them, and then you make a fist right, below your belly to do the Heimlich, and you squeeze as much as you can, as hard and fast. If you're able to do, if you're not able to do it while they're sitting on the chair, then your next thing to do is to put them on the floor flat on their back, and then you get on top of them, and then of course with both hands, with the heel of your hand, you place it right below the belly, and then you start to do the Heimlich. You start to do the thrust and forward fast. These are the indicators that will help to get that food out of lungs, or if it's lodged in the throat as well. There are two types of obstructions, what's called partial obstruction, airway obstruction, and you have full airway obstruction. Either one is a life-threatening situation. And of course, your goal is to continue to do the Heimlich until that person has no pulse. If there is no pulse as you're doing that, there's not responsive, and there's no pulse, then you immediately have to switch to do CPR. And that will be your next course of action. Of course, hopefully your emergency response team will get to you as soon as possible. But once again, it's doing what you to resolve the issue rather than not doing anything. It's a big difference when it comes to that.
That's great. That's great to hear. I mean, for me, yes, I'm up to not yet see the actual, like on the household, knock on wood. It's really good to know what to do to stay calm and just do what you can in terms of if there's somebody in need of, if they experience some choking and everything like that, right? So anyway, so in your experience, Rudy, maybe you can share us some story which you've encountered in your professional experience, like a real life experience that you had. Maybe you can share a thing or two in what situation and how did you handle that type of situation, or what you call this emergency that you've seen so far.
Of course. One of them was, I'll give you a couple. One was pediatrics and the other one was geriatrics. The pediatrics experience I was working for this hospital in the pediatric unit, and I went into the room. The mother was there, the son was there, and the patient was the daughter. She was 5 years old. And I went in there for breathing treatment. The patient had asthma. And as I'm setting up the equipment getting ready to give her the breathing treatment to this little girl. I hear the mom scream saying, "Oh my gosh, she's choking." And I turn around. I'm like, "What's going on?" And the mom goes, "Oh, I think she's choking." And I'm like, "What? Like, how is that?" She was just sitting on the bed, and now the mom is screaming that the kid is choking. Of course, immediately I jump into action. I started to assess, and I picked her up, and I started to do the Heimlich, but she went unconscious. So I'm doing that. Of course, I had activated EMS already by the time I started to work on her. So immediately, soon after, the team comes in. At this time, the child went unconscious, and we started to do CPR. I started to manage the airway. I was bagging the patient as the nurse was doing compressions. And what was interesting is that, because they were asking what happened, I was like, I don't know. I don't. Mom says choking, and that's what's going on. But we didn't know the source. There you go, of the cause of the kid choking. The little brother, the brother that came in, that was there with mom, said, "I gave her a grape. She loves grapes, so I brought her some grapes," and the mother didn't know. I guess he had them in his pockets. And brother, little sister, they love it. He knows that she loves grapes, so wanted to bring her some grapes. But unfortunately, that was the reason that the child was choking. What was interesting is that as we're doing CPR, I was bagging the patient. Finally, at the beginning, there was obstruction, so air was not going into the lungs, and of course compressions, and then my turn to give breath. Prior to that, I would look at the mouth to see if I could see anything, and I couldn't. Then I would attempt to give another breath with the ambu bag. And about probably the third attempt of trying to give the child a breath, I noticed that the left lung left, and I could feel that air went in, but it was the left lung.
Left lung.
Yeah, and that's a good. We got air in. That's
Inside, yeah.
At least it's one lung, right? You're able to. And so what happened is, of course, we brought it back, we stabilized her, and we sent her to OR to find out what happened. And so what happened at the end is that the grape traveled to the right side of the lung, and it got lodged in there. Because as I was trying to attempt to give a breath, that air that I was trying to push in, it was being pushed, the grape, slowly
Down.
Into the side of the
right
lung,
line.
and this is why the left was open for air to go in. Bronchoscopy. They went in there and they grabbed the grape, pulled it out, and that's what happened at the end. It was grape. It went to the right side, and that's when I realized, wow, this is interesting, because good thing left lung was functional. I was able to get air in there. Otherwise, probably would have lost her, most likely.
Yeah. How long did it take though to figure out that the grape is there?
So after she was brought back, they sent her to OR to see what happened. And they did an X-ray, and they couldn't see what was going on there. They must have seen something, and so they did a bronchoscopy. There you go. And so that's where they were able to pull it out. But the reason why we knew it was a grape, because the kid said, "Oh, I gave my sister a grape." So we figured that's probably what happened. It was
that's
a grape.
why. At least you guys knew what caused the choking, right?
Yes. And so that was the pediatric end. Another incident that took place years later. This was a 80-year-old female. I was in the unit, and we went to a room not to the room, but to the dining room, because there was the nurse called saying that the patient was choking. That was the call that we got. So when we got there to the dining room, the female patient was slumped on the table. Her food was on the side, and so immediately we thought, okay, she's choking, right? Because she's eating. She's there. The nurse says that she was choking, and here we are going to rescue the patient. So immediately we pulled her out of the chair, got her out of the chair, put her on the floor with my team, and one of the nurses got on top of that patient to start to do the Heimlich. And I started to work in the airway. And so the thing I noticed about it is that when I started to bag the patient to get air in, the patient was foaming out of her mouth and her teeth were shut, very close shut. And when I give the first breath, I noticed that her teeth are shut closed. She's foaming out of her mouth and she was very stiff, still alive. And then I look at the nurse and I say, I don't think this patient is choking. I think this patient is having a seizure.
With
And
foaming, right? One indication that they might be seizing, right?
yeah, and it could be mistaken as choking because it looks like table, right? And so the nurse thought choking incident. Just because you think you're dealing with something doesn't mean that's what it is.
Yeah.
So it is important to pay attention to what's happening.
And you mentioned assess the patient.
Assessment is very important. What did some cause this? And so you do the best you can and your skills. And so immediately from, okay, stop doing the Heimlich, it's not choking, to I think it's a seizure that we're dealing with. And so we immediately switch to taking care of the patient. In this case, would be provide oxygen, 100% oxygen, of course, and give her medication, and of course transfer into the ICU unit. But that was another interesting experience to be part of. That oftentimes you think that's what you're dealing with, but it may not be it. Just the fact that you are assessing, you are engaging, you're trying to figure out what's happening. Being in the medical field also can be very challenging, not to mention someone who's not in the medical field. So I always stress the knowledge that start with 911. You start with 911 and then get back to the patient, start working with the patient. And if you don't know what's going on, you also have someone on the emergency response line that can also help you trying to figure out what's going on with that patient.
That's good. That's I bet it's scary at the same time in the adrenaline rush, right? Really,
it is. It would be wrong for me to say it's not a scary situation to be part of, because it is. But one of the things that I always try to teach my students is that when you know the principles and stick to those principles, you will find yourself more control over whatever situation it is. Stick to the principality of things. What is my first step? If you remember first and second step, the chances of things progressing in a way that you'll remember as you're doing things is greater. Correct. Rather than going, oh my God, what do I do?
What do I do?
Yeah, what's next? That part, that sense of feeling of not knowing and being scared, that's the part that's very concerning. Because then what's going to happen is you will have a mental block, and then you're not going to be able to push from there. I always tell my students, at least remember the principal steps. If anything, call 911. Start from there. If you forgot everything else, or if you don't know what to do, start from that moment, because that will give you more. Your memory will come back as you are being coached or how to handle the situation.
Nice. Okay. Now, since you mentioned about the basic principles, maybe you can share to our viewers out there about what are the basic principles that they need to know now if they encounter such incident, or should we say emergency. Can you please share to us what are the basic principles that at least they should know in order for them to be prepared?
Of course. Yeah, first thing is first thing, and that is to understand what are the high risk that your loved one may experience, what their medical health is, obviously. So that will be your basic principle, is to understand their medical condition and also understand what could be the things that may come out. And so I'll give you an example. For instance, someone who has a hard time when they're eating and they're coughing, and then they drink a little bit of water and they're coughing. It could be because their swallowing mechanism is not working properly. So that is an indication, a basic principle where you understand, okay, my grandpa or my grandma, every time he eats or drinks, she coughs. And oftentimes we don't see it as a situation that may get worse, which is grandpa. Every time he drinks, he coughs, right?
Yeah.
But in reality, that's a clear indication that they are prone to choking. So that will be one of the basic things that you want to understand is what you're dealing with. And then, of course, the next thing is to, okay, if this happens, what do I do? The next part would be to assess, right? Okay, they're choking. That's what's happening. You know that's what's happening. So your next thing to is to call 911, right?
Correct.
Okay. And then, of course, the next big step would be to engage. Now that you identify that your loved one was prone to this condition, now they have it. It's setting up a plan. I call it a theoretical plan where you're simulating on what the patient has or what the patient's condition is. You go to the next step. Okay, having trouble swallowing, the potential is going to choke. What do I do next when it happens?
Correct.
That will be your basic plan, is just to simulate those situations, just like a fire drill.
Correct.
Fire drills, that's why they are important to have a fire drill, because it prepares you for what to do when it happens, rather than saying, oh, please don't say that, oh, I hope it never happens.
Yeah.
That's the wrong attitude, because we're past that. We have to face the facts, and practice is what's going to make an outcome better.
Yes.
If you find yourself in that situation.
That's great to hear. I mean, for me, I really wanted to that one because it can save lives of that matter. We know that you're a certified trainer for CPR and first aid. Maybe in your own experience, let's say you mentioned about their students, right? Have they shared some success stories that they've encountered through your own teachings?
Absolutely. I went to a facility to teach a CPR class, and as I am teaching the choking part of it, one of the ladies, she's a caretaker. She was raising her hand as I'm explaining what to do when someone's choking. And I stopped the class for a second. Yeah, and she's, oh my gosh, she goes, I had known this before, she says. And what I was discussing was, when someone's choking, if the person that you're going to help is bigger than you are, and when I'm saying bigger, body height, body weight, right? This lady, she was like 5'4", 5 feet, and probably like 130 pounds, petite caregiver. And the person that she attended to rescue from choking, the individual was 6 feet tall, 250 pounds.
Wow.
When I was explaining, every time you engage into taking care of someone, the first thing you want to make sure that you're safe. Am I safe to take care of you?
Correct.
If you're 250 pounds and I'm only 125 pounds, if you're 6 feet tall, I'm only 5'4", right there you have an imbalance.
Ratio. That's a huge disadvantage.
It is that you're already in a disadvantage. What happened is she shared her story, and that was, she said, yeah, this patient, tall, 250 pounds, and all I hear is from classes that I've taken before, she says, is that when someone's choking, you get behind them and you start to do the Heimlich, with your hands. And she goes, first of all, I couldn't reach the area where I wanted to because it's so big. Yeah. Second of all, I couldn't embrace him because he's a big person, wider person. But regardless, she did. She tried, and as she was trying to, the patient went unconscious. And as the patient went unconscious, now you have 250 pounds on you. She thought she could hold the body weight. And of course she didn't. So when he passed out unconscious, or he went unconscious, he fell on top of her.
Oh, wow.
So they both went down on the floor. And as a result of that, her wrist was injured. Broken. And the gentleman wasn't hurt.
Yeah, it's big.
Now you have this person of you and she hurt her wrist and she got injured, and now she's the one that needs rescuing as well.
Yeah.
So when her coworkers can help, they have to pick up that body away from her body, being on top of hers. And so when I explained to them, look, the first thing you do is you look at the person and you ask yourself, will I be able to? Because, and if you're not, what you do is you tell the person, you're choking? Yes, I will help you, but lay on the floor.
Yes.
If they're still alive, they're still responding. You get on the floor, lay on your back, I'll help you. Then you get on top of them, and then you do the hind leg that way. Now, if they passed out, they're on the floor already. They're not going to hurt you. What you do is you switch, check for pulse. If there's no pulse, then you start CPR. So this is the part of the class that I was teaching. And she was like, I got to tell you this.
Yeah, she really wanted to hear her experience.
Right. And unfortunately, I'm teaching the class based on experience. I'm teaching the class based on things that happen. Because when you take a CPR course, that particular, whatever class you take, doesn't matter what class you take or who you take it, this information is not given to the students. Because these things they're not scenarios to practice upon to teach the class. These classes don't have that content. And it makes sense because these courses are to give you the principle, the steps that when you do CPR, when you help someone from choking. And that's fine, but there's also information that's shared by the instructors. And that's because either they have had an experience like that, or they have never have heard of anything like that. That is different than what the class teaches you. So my class has always been talking about situations that take place in the classroom in their experience. And this is where this information is being shared by these individuals. And it has been an eye-opener for me because then I grab that information, learn, but also from what I experienced, and then I share that. It becomes a shared information at that point. And it really is an eye-opener for them. It's time to realize, wow, I could have done things differently.
That's great. That's great to hear. That's great to hear, Rudy. You mentioned about, let's say, your experiences and the stories, right? Since you started, correct me if I'm wrong, like 25 years ago of your experience as a respiratory therapist, what can you say, or if you notice some changes that they did? Because I remember vividly, or I remember before when we're doing CPR, mouth-to-mouth resuscitation, right? And last time I took a training with you, not part of it anymore for you to do the mouth-to-mouth anymore. Maybe you can share some of the latest changes that they did in performing CPR or first aid.
Of course, the medical field is always evolving, always making progress. It's always making changes, and it's good because things do change in life. It's not your routine, normal circumstances. There's going to be some adapt to that. And so as we are making progress in not only keeping the person that's rescuing that person from whatever the situation is, the rescuers have to stay safe. So when you're a rescuer, safety is important prior to engaging into rescuing someone. And so when it comes to mouth resuscitation, yes, I remember in high school video, and the paramedics arrived, the person is on the floor, this gentleman is on the floor, and they do mouth to mouth and compressions. And I remember going, oh man, I hope I never do that.
Exactly.
My ranger's mouth, right? That was mind-boggling. That was the norm. That was the norm. To do mouth to mouth. That was there, right? Throughout the years from that moment to now, and progress and medical conditions, diseases that have come up, and will continue to come up, I think, when it comes to sickness and diseases. We have to establish a environment for those that rescue, those that need to rescue. And of course, one of the things that we talk about is we do what is called hands-on compressions only, or hands-on CPR only. And from that stems studies and science that backs it up, where you have science telling us that when the patient collapses, goes unconscious, the lungs don't flatten, they don't deflate.
Yeah.
And so that's a science that, again, that we have made progress in learning and understanding. And so they say when somebody collapses, they still have air in the lungs. There's still air in the lungs. They don't shut, they don't collapse. So doing only helps improve or helping that person back to life, but just doing chest compressions because you have blood flow circulating for the amount of oxygen that's in the blood. Typically, when someone collapses, they still have oxygen in their body. And so if you start to do chest compressions, you're circulating that oxygen that is in the body. It's just not moving because the lungs are not inflating. They're not taking a breath, obviously. But as that compression is taking place, you have this circulation in combination with the oxygen that's being circulated. We call that hands-on only. That's if you don't have means to provide ventilation. What does that mean is if you don't have a mouth-bearing device, then it's not recommended to do mouth-to-mouth. Of course, there are exceptions to the rule, and I'll give you an example. When it's someone that is within your circle, and what I mean by that is, let's say a family member happens to be a family member that you're gonna do CPR on, you know how and what member has. So putting your mouth over your loved one to do compressions and breath, that is okay.
Yeah.
It's a person that you know, it's a person that it is
safer
to do that than randomly someone on the streets to do CPR and trying to put your mouth on that person, right?
Yeah, definitely. I think I heard that story. I don't know from you that somebody gave a mouth to mouth and I forgot the disease that they got, but it does happen. Like
yes,
they did a mouth to mouth, then they transmitted the disease towards the one who's saving the person.
Yeah, and thank you for bringing that up. A few years back, two sisters, they were both nurses, and the cousin, he was a drug addict. There was a birthday party, and the cousin he overdosed, collapses, and when he fell, he broke his nose. He's bleeding in his face, and one of the sisters tells the other sister, "Hey, don't do mouth to mouth, just do chest compression." And the sister goes, "Oh, it's our cousin," and so she does. She gives mouth to mouth. So she ended up getting hepatitis from it. And even though it was her cousin, even though it was family member, she found herself and she contracted hepatitis from her own cousin. Even though the other sister saying, "No, don't."
Yeah.
Just do this compression. But the other cousin, "No, it's my cousin. I need to rescue." But she ended up getting hepatitis as well. So that's a perfect example of if you don't have a mouth-bearing device, then the best thing to do is to chest and do chest compressions until paramedics arrive, emergency response team comes in and takes over. So one of the things that we highly recommend is to use a mouth-bearing device. There are different types out there, and that will be your first line of defense. And in this case, whether you're with a loved one or not, it's always good to have one.
Yeah, that's great to hear. You've shared to us your expertise and your experiences to our viewers out there. I guess we're running out of time right now. And Rudy, I'm really thankful that you took the time to bring what your thoughts, your experience, and your expertise in respiratory therapy. Maybe looking ahead, what are your future plans in terms of providing some education to potential clients or patients? Maybe you can share us some latest updates for you.
Yeah, absolutely. In a way that understands what it takes to be able to perform in different situations. Breathing or airway management is the most common situations that most of us experience or run into. And of course, that will be to enlighten and give some enlightenment. There you go. In the fact that if you build a foundation and and simulate situations that could potentially happen, that would be the start, the fresh start. And I want to be able to share that with the audience and be able to not only that, but give them a good sense of feeling confident that if they find a situation, and hopefully would cover most of them, they'll be able to perform. And it does make you feel good when you know you did the best you could, and also when you learn and understand the subject better.
That's great. That's great to hear. Or maybe you can end this interview or podcast. I would like to take this opportunity to thank you and for giving me the time to be here. And maybe just to share with you guys, me and Rudy are planning on putting up some project, like an educational content for you guys out there. So better watch out for that one. And please, Rudy, share to our viewers where they can follow you, or if they're interested in getting some certification for their CPR and first aid training, please do share to our viewers out there the information about it.
Of course,
Yeah.
obviously, and it's to teach CPR at the request of the individual, of course. At this time, I don't have anything to give, to provide, but you and I, we're going to be working on that and spreading the information and sharing it with them, obviously.
And watch out, guys, okay? This is great content. And as you can see, I'm having fun just listening to Rudy. I'm learning a lot from him right now. That's why right now my mind, just to share with you, Rudy, my mind is like racing right now on what can we share to our viewers out there about your knowledge. Because it's really powerful after hearing from you after this interview. I know for a fact that you can help a lot of people by sharing what to do in terms of like emergency. So I thank you very much for joining us here.
Looking forward to sharing all, and it feels good to be able to do that, and thank you for giving me the opportunity to be able to put it out there. It feels good. It feels good to know. It feels good to stand the subject, and it builds confidence in all of us. And it doesn't matter how old you are as far as learning the information. It's so good to know that we will be able to bring to our audience in the near future, that they can look at it and relate to those scenarios, and we'll give them the foundation and building their confidence in how to take care of their loved ones.
All right. Thank you. All right. Another fantastic episode that we've had for you for the sandwich generation. Always remember to be alert every time and make sure to know the basic principles according to Rudy. And you should know the basic principles on how to save a life if they're like, let's say, having some choking issue or whatnot. Okay. So again, this is another episode of UPCEO Project Podcast. This is Francis Santiago. Thank you very much and have a good day.
Thank you.
UPCEO, UPCEO, unemployed Pinoy, CEO, unemployed Pinoy, CEO. What's your story? What's your humble beginning? How did it happen? Come on and share it with the world. Be an inspiration throughout every nation. Tell me your story.